about today's pharmacist in Australia. Now, the scope of pharmacy in Australia is expanding. When I say the scope, I'm saying what an Australian pharmacist does, okay? So Australia is a very good place in terms of like the pharmacy practice. Why do I say that? I say that because it's still an emerging practice. It's still a practice that is growing. Just recently, they've expanded what pharmacists can do. We're doing a bit of prescribing around UTIs. We're doing prescribing around contraception drugs. We are able to vaccinate, and also we are able to deliver more medicines to be delivered by injection. So what I'm saying is the Australian pharmacist is not just like a boxed pharmacist with little or nothing to do. There's a lot that you can do as an Australian pharmacist. I know you must have seen, in a lot of places saying the number of pharmacists that they're allowing to come to Australia is reducing. The market is getting a bit saturated and things like that. Yes, and also no. Yes, in the sense that, after COVID, there was a surge and there was need for Australian pharmacists. But as COVID is relaxing, it's dropping a bit. But for those people who have the right skill set, it's still a big industry. For those people with the right skill set, there is still opportunities. I know that because I'm an overseas trained pharmacist myself. I'm an employing manager, so I do know there is still opportunities for people to come to Australia and also grow. Now, as an overseas trained pharmacist, most of you have already worked so many years already in your home country, and it's important that when you're thinking about coming to Australia, don't just think about the short term of, I just want to come to Australia. Think about setting yourself right so that after your internship, you can get a good position, a good offer, a good paying job. Now, there's no blanket pay in Australia. So there's something we call the award rate. The award rate is the standard rate that they have recommended a pharmacist should be paid. But if your skill set is really good, you can be paid a lot. So that's something that I really want you to have in mind. It's good you have the required skill set. And being an Australian pharmacist gives you opportunity to do a couple of things at the same time. So you can be a community pharmacist, you can be a clinical educator like myself, like I'm working in different areas of pharmacy. You can be an industry leader, you can be in the hospital, you can be a credentialed pharmacist. So there's a lot of spots for you to be able to function in the Australian industry. Now let's talk about how do you set yourself right? It starts from you preparing after you've sat your kaps. So the kaps is a knowledge test. For the kaps is just a general knowledge test. But when you're preparing for your internship, it's really important that you have the right skill set. I'm sure if you have friends or people who are working as pharmacists in Australia, ask them about their intern year. They will tell you about a lot of struggle, a lot of difficulty trying to pass through that year because the practice here is different. No matter how many years of experience that you have somewhere else, once you come here, there's a lot of adjustments to do. So that's why it's really important for you to set yourself right. And yes, the need for pharmacists might be reducing, but the need for good pharmacists is still there. Okay. Now, let's talk a little bit about top pharmacist roles and their pay. Now, this is just a range, right? A lot of pharmacists walk around the space and they earn more and less. So you've got the community pharmacies. Now, this is based on a full-time job. Mixed practice is when, you can be doing community pharmacy and be doing accredited pharmacy. So it means you're credentialed, you can go to people's home and review their medication. A local pharmacist is a pharmacist that works in different areas, in different outlets and all of that. So they are not fixed to a particular pharmacy or to a particular store. We have the hospital pharmacist and we have the general practice pharmacist that usually works with the clinic. Now, these are not absolute figures, but I'm just trying to give you an idea of what, a pharmacist in Australia can earn. Now, there's no limit to what you can earn if you have the right skill set. I'm emphasizing on that because it's really important that you know that, your skill set will determine how much you earn. So you may just be a basic pharmacist, just earning the award rates, or you can actually be above the line and earn more. Now, when we're talking about what are the factors that can affect how much you earn here in Australia? Again, I've been talking a little bit so much this evening about experience because it's very important. Australian local experience is quite important. It would affect your pay. If you do have leadership skills, that is very good. So I highly recommend that when you come into Australia, during your intern year, try to link up with a industry mentor, someone who can show you the right path, who can show you the way of becoming, very valuable within a short period of time. The other thing that can affect your pay is the location. So, are you working in a rural area? Are you working in the city? Are you working in towns that are quite populated with pharmacists or not? Those are the things that might affect, what pay. Now, your hours too would affect, are you working overtime? Are you working irregular hours? Are you working on the weekends? It really matters. Those things would affect how you earn. Now, there are some jobs that are more time consuming. They may pay more, but they're also more time consuming. I just want to let you know generally, just to manage your expectation, for most overseas trained pharmacies, our beginning point is usually community pharmacy. It's very hard for you to see internship sponsorship offers for hospital, because usually most of especially the government hospitals, most of them requires you to have PR, citizenship, and all of that. So usually the first step that most community pharmacies would accept you as an overseas trained pharmacist. So community pharmacy might usually be where you start from, but then from community pharmacy, as you build your experience, you can always move to other industries. As because I know people have different backgrounds, right? Now, the other thing to know, factors that can affect your pay. Your internship here is very critical to the beginning of your career. Now, for people who do very well in their intern year, when I say do very well, people who equip themselves with the right skill, it gives them opportunity to start at a very good place. So for me, when I did my internship, after my internship, I became a pharmacist in charge directly. What that means is it gives you the opportunity to actually start on a good pedestrian. So that's why I always encourage that, take your internship here very serious. Your internship here is that time that you display your skill set and show your employer that you are valuable, and there's no limit. Once you've started on a high note, it only gets better from there.